Well, good morning, everybody. I've got the top of the hour, so let's just kick off this August podcast. Um, all things aging. Good morning. This is Angie. I'm with Producers XL, and we're going to talk this month on the podcast about a report that I received, I don't know, earlier this, would have been last week, actually. CVS Health actually put out a kind of the future of healthy aging, if you will. And so, of course, I like to read this kind of stuff, see what's going on, see what's trending, and see how relatable it is to what I guess I'm seeing and experiencing, not just with my own family, as that aging process happens, but if that's kind of the same thing that I'm hearing. So I'm going to jump right in and let's kind of talk about some of the things that I've highlighted out of this report, which I don't know. Sometimes I take pause and I'm like, I don't know. It's not how I'm seeing things. But hey, they've got the statistics for the report. It says here, America's aging well, and that's a good thing. Thanks to the increasing lifespans and the falling birth rates, 1 in 5 Americans will be 65 years old by 2030, right? So 7 years from now, we're going to have 1 in 5 Americans age 65. And we've been kind of pushing through this. It says here, but this demographic makeup is new for the country, and it's going to mean that we're going to need some changes to the healthcare system. And I think probably COVID forced a lot of changes in that space as well. So let's kind of dig into some of the things that they've highlighted through this. It says, the good news is that baby boomers, the generation that was born years after World War II, make up the most novel group. It says about 3 out of 4 older adults rate their health as good or excellent, showing that the stereotype of frail old age no longer holds true for everyone. I got to tell you, I don't think 65 is old. I don't know if it's because every year I have a birthday, I get a little closer to it, but yeah, I mean, I do think folks in that age demographic are aging well, because to me, what I'm seeing is 65-year-olds are very vibrant. I mean, some of them are still actively working, exercising, doing all kinds of things. It says exceptional longevity is also expected to grow, with the population of centurions, people that are 100 years or older, reaching 6 times its current size by the year 2060. I don't know, when I talk to a lot of folks, they're like, I really don't want to be 100 years old. But you know what? If you could be 100 and vibrant, that's when you can really say age is just a number. Older Americans tend to have more chronic conditions, which, I mean, go figure. As you age, things just don't always, your health doesn't hold as steady as it did when you were younger. And according to the American Hospital Association, it estimates that by 2030, just a mere 7 years from now, the system will be dealing with twice as many hospital admissions and physicians' visits for baby boomers. At least 2 out of 3 older adults also are expected to need long-term care services for an average of about 3 years in their lives, according to the U.S. Department of Health and Human Services. How many of you wondered how I was going to tie this back to a long-term care conversation? So 2 out of 3 adults are also going to be expected to need some sort of long-term care service. So the topic around extended care planning, how are we going to resonate this to the consumers while they're all experiencing at age 65, regardless if they're still working, not working, that Medicare conversation is going to happen, right? It's going to happen at some point. They need to understand that Medicare, page 28 of the Medicare and You Handbook, as well as page 52, addresses what it does not pay for. And it clearly states in there, Medicare's not paying for long-term care, extended care. There's other ways to get those services. So it'll be interesting to see the dynamic. Now, the beautiful thing of the Pension Protection Act, right? It allowed us to solve the extended care need in many different ways. It's not just traditional, it's life insurance, it's hybrid policies, it's annuities, it's short-term care, lots of ways. we have to have that conversation about what does that look like. And as the population ages, obviously, if we've got older Americans having more and more chronic conditions and living with them, with twice as many hospital admissions and physicians visits, that conversation is going to have to be had. Most of the time it's had when we're in a situation when obviously you can't buy the coverage. It says, new systems will need to keep pace not only with more care, but often care that's more complex. So it'll be interesting to see how that all works out. They've also talked in here about improving home-based care. Older Americans are keen to receive health care at home. According to polling from the National Health Project, a collaboration between Harris Poll and CVS Health, 4 out of 5 people 65 and older say they would prefer to receive care in their own residence, rather than at a medical facility. I don't think that's shocking to anybody. Everybody says they want to stay at home. You get admitted to the hospital, what's the first thing they say when they come out of anesthesia? When am I going home? So that's really not a surprise that people want to receive their care at home. You know, you actually have short-term care solutions that pay for really nice home health care benefits. So something to consider. Pandemic concerns about infection in hospitals and long-term care facilities have strengthened this desire. That couldn't even have been more true than in my family. When my mother-in-law was going through a lot of her illnesses, my sister-in-law said, who happens to be a nurse, absolutely not are we sending mom to a nursing home to recover from her acute need. She said, I'm just going to take 4 weeks of FMLA. And she stayed home and rehabbed her mother in her own home, in her mom's home, because that pandemic concern was very real. She thought for sure she would get in there and most likely end up with COVID. And obviously with a suppressed immune system with some health issues, she didn't want to take that chance. It says the good news is that avenues for this kind of care have grown significantly, and more Medicare Advantage plans are offering supplemental in-home services. You know, I've even seen some things here recently about the state of Minnesota looking at adding some home health care features to a Medicare supplement and or Medicare Advantage plans to try and provide that rehab care in home for those folks, trying to keep them out of facilities, obviously the most expensive level of care. CVS says here, one innovative program from CVS Health is looking to expand home-based care for those discharged from an acute care setting. The post-acute care transition program, slated to launch in spring of 23, will assign a nurse caregiver to the home and provide other necessary resources. That might mean aiding patients for reconciling medications with their primary care, ensuring that their home is age-friendly, offering home visits, helping with food, transportation. It says a recent study published in the American Journal of Managed Care showed patients discharged to home health care services like this were 60% less likely to be readmitted to a hospital within 30 days. I have to tell you, dismissal and readmissions at the hospital level is a lot of the reasons why people are under observation in hospitals and not admitted to hospitals, because then if you're not admitted, you can't be discharged. There's a whole reimbursement thing that goes on around this. It's a very real thing. So I do believe that is something. I mean, I don't know how we're going to find the caregivers, the nurses, the people to provide all of this. In a perfect world, this stuff is absolutely necessary, because when older folks, and I mean, I think just exclusively to my mother-in-law and having her come home, that would have been such a huge benefit to have someone be there with her and help her, as opposed to having the kids try to, manage all of that. It says here, leaning into that whole virtual care, that's always been interesting. How many of you have actually had an e-appointment where you had a doctor's appointment sitting in your house? Nearly half of people age 65 and older have now used it, according to a report, and they're getting fairly comfortable with it. Of course, we'll see kind of how everybody feels when we get back into the flu season and what that looks like, and if we'll do more telehealth, but we are definitely seeing more e-visits become more popular. Instead of bringing somebody with the common cold or the, ear infection or what strep throat or whatever. They'll diagnose, call out the medication, you go pick it up and you go home and you recover. Using prescription as an opportunity. Nearly 9 in 10 adults 65 and older take a prescription, and half of them take 4 or more. It's going to take a combination of strategies to serve the growing population of older adults. The key will be to meet them in the places where they're most comfortable in getting their care. And I made a note down here. I thought this was interesting. Long-term care insurance is not, or long-term care, not insurance, long-term care is not when a loved one becomes inconvenient, but rather when they are chronically ill. I can't tell you how many phone calls I get, emails I get. The kids are kind of getting a little distraught, dare I say, a little annoyed. A daughter knew her mom had a long-term care policy and was ready to put mom on claim. She was needing some help. She was kind of the primary one, and mom's anxiety was kind of getting the best of her. There was a lot of 2, 3, and 4 a.m. phone calls because mom was very anxious. And the daughter was like, I think she's ready for some home health care, or maybe we need to look at assisted living care. And so when you say long-term care is not when a loved one becomes inconvenient, that's very real, right? So we have to remember the definition of being chronically ill. Your 2 out of 6 activities of daily living, or the severe cognitive impairment. There is such a pain point between the family realizing that things aren't looking good and the point that they're actual claim eligible. That is a very big pain point for families. So drawing the distinction of what long-term care insurance is designed to do is very important. So I kind of wanted to bring that up. Also this, older adults is not an age, but it's a healthy number. I think we see that to be true. I stated earlier, I think I see a lot of vibrant 65, even 70-year-olds. I had one of my girlfriends went to an uncle's 90th birthday party in Kansas City. Still sharp, still had his memory, still walked. He walked every day, 2 miles a day. Now, wasn't a marathon sprint or anything like that, but still out there walking every day. I have to tell you, that is probably where I see the biggest decline, is that folks just stop moving. And it seems to be around that 70 age. Now, granted, chronic illnesses take all different types of forms, and health conditions can limit mobility for sure. I mean, I've got a 50-year-old brother that his mobility is not well and all, and it's because he was septic, and now he's got herniated discs, some bulging disc in his back. So moving is very difficult. So I do understand that, but I also understand that I've got 2 ladies in my life that I see just sitting all day long. And that is not good for the human body. It has to move. I mean, how many of us, as we have birthdays, and I'm fixing to have one, you wake up and you just feel a little stiffer than you were last year? You got to move the body to keep it in motion. And that actually brings me to the next thing. So think about just the constant sitting, and if your only interaction with people was the TV. It says here, declining mental health and aging don't go hand in hand. In fact, studies find that older Americans tend to be happier and more content than their younger peers. I could go along with that. But aging can bring special challenges. And according to a 2021 Healthcare Insights study by CVS Health, 39% of providers have a high level of concern about the mental health of their patients over 65. In fact, other research shows that about 20% of retirement age Americans have been diagnosed with a mental health condition. Grief and loss can be a prominent part of their psychological experience, and I think that's what most people think about. If I live to 100, I'm going to outlive my family, definitely my friends. So it's interesting to me. And when I really kind of settle in to thinking about this with my heart instead of logic, this is so real. This is so terribly real. You think about somebody with limited mobility, or they've gone through a health event. Maybe they're not chronically ill, but they're just not well. They just don't feel good. You start to see that isolation and that loneliness and the unhappiness. And I have to tell you what, I can't give enough kudos to people like my sister-in-law that work a full-time job, every night goes and hangs out with her mom, unless she just needs a break herself and she stays home, or people that are caregivers or really companions. There's something very real to that. And I'm reading from the survey, there's also the isolation and loneliness that comes with age, which can have a significant adverse effect on mental and physical health. That factor alone can increase the risk of dementia, heart disease, stroke, depression, and anxiety. This resonates with me. This resonates with me in what I've seen in my own personal family. It is so true. And I can remember my mom saying things like, grandchildren are just a beautiful thing. They're an absolutely wonderful thing. If we could have our grandkids before we had our kids, if we could figure that out, that would just be wonderful. She said, but your grandkids age, and as they age, right, they start to pull away as well. So think about if you have an older parent and now you're busy with your daily grind and raising your family, and you've got all your life, if you're keeping a schedule of all of your family's activities, somewhere in there, you've got to build in touching base with the grandparents. It's not just Grandparents' Day on that one particular Sunday. They need that. And they need it from their children as well as their grandchildren. It's really, really important. A recent CVS Health National Health Project poll showed that a surprising 94% of people 65 and older rated their own mental health as well or very well, which is far higher than the younger generations. And it's at odds with much of the research about the prevalence of mental illness in this group. It says part of it may be that the current generation of older adults didn't grow up talking about mental stress. I think we can all agree on that. They either toughed it out or maybe talked to their religious leaders about their problems, certainly didn't discuss it with their healthcare providers, certainly didn't publicize it on social media. That same poll finds that only 14% of adults from this group are willing to talk to their primary care about mental health concerns. So keeping it all tucked away doesn't bode well for their health as well. It says, you mentioned social isolation. Research from the National Academy suggests that 1/4 of older Americans are socially isolated. So there's got to be ways to help them interact, go to coffee, go to the library, just find ways to keep that stimulus going for them. It says just 43% of people who are 65 and older have tried to access mental health, as opposed to 75% of people under the age of 65. A big growth in virtual mental health care has helped with accessibility issues in the wider population. And then they have a question here, will that solution work for this group? I don't know. Time will tell how that plays out. Some of the things one of the last things I wanted to leave with you on this says as people live longer and the last of the baby boomer generation born between 1946 and 1964 hits retirement age, the average American will be older than ever. By 2034, 1 in 5 people in the United States will be 65 or older, roughly matching the size of the population under 18 for the first time in history. We got 2 massive waves of generations. This older generation will reinvent definitions of aging, bringing new needs and attitudes towards healthcare and healthy living. There are almost 332 million people in the United States, of which today 56 million are over 65, and another 65 million are between 50 and 64. So healthcare, long-term care, short-term care, ways that services are rendered for these people will obviously vary greatly. By 2060, the population over 85 will almost triple. And in the next 40 years, 500,000 plus people will turn 100 years old or more. These are some staggering. If we start thinking about sales opportunities and conversations that need to be had, people 65 plus may require help with their physical limitations, including hearing, vision, cognition, getting around, and self-care. Some of the other things that I've pulled out from here, 4 in 5 say they prefer to get their treatment at home. About half of those say that they would be healthier if they had more care at home. And the need for home health care aides is going to grow by 25% between 2021 and 2031, just because that's where the care is going to want to be rendered. So again, if you're not looking into short-term care or home health care options, sometimes people are just adverse to paying premium. But these little solutions do offer some viable benefits. And I think this was interesting as well. People who think they have a high quality of life, 37% said they think they have a high quality life, ages between 50 and 59, and 49% are ages 60 to 69. But when you get up to age 70 plus, you've got over 60% of those people stating that they have a high quality of life. I didn't want to end our podcast on a low note. So the good news is they do believe they have a high quality of life. It'll just be interesting where we meet our aging population in how they want to receive care. So keep that in mind as you start having your Medicare conversations, right? Medicare's a federally standardized program. It is what it is. It covers what it covers. But meeting them with a comprehensive health plan in helping that family through all stages of life, not just the healthy stages of life. That's where that extended care conversation comes in. And if that extended care looks like short-term care, that's okay too. Some people can't afford it. Some people can't qualify for underwriting. Some people just won't. So it's okay to have conversations about shorter durations, as well as longer term if we need to pivot into that conversation. Of course, you still have your hybrids. So I'm not a one size fits all, but I do think the conversations need to be had so that folks understand what's covered, what's not covered, and all the different things they want to be talked about. I will tell you, I've had some conversations here recently with fee-only based planners, as well as RIA hybrids where they can receive commissions. I've had conversations where their clients are being approached about long-term care solutions. And some of those conversations involve using assets under management to reposition. That doesn't necessarily sit real well, taking those out. I think one of the recent conversations I had was somebody wanting to use a third of someone's investable assets to reposition for a long-term care solution. And the advisor was not thrilled about that option. So we came up with a better plan that didn't take a lot out of cash flow and still worked within the budget and still left those assets intact so they could work a little harder on the investment side. So I think what that says to me is the conversations have got to come up. We have to have those conversations with our clients and at least inform them. It's no different than when you're raising your children. I always told my daughter, you can't make an informed decision if you don't have information. Can't make an educated decision if you don't get educated on the matter. That's all we are. Informers and educators. We're just here to explain to them what's out there, what the solutions look like. And if there's something we can do to help them, that's what we should do. So with that, thank you very much for tuning in. Join us again next month. I think I might have something pretty interesting on the line for the month of September now that we're all settling back in. Got Labor Day coming up. September, we'll have another podcast the last Tuesday of the month. And again, have a wonderful day, everybody. And thanks for tuning in.